So, addiction treatment and relapse prevention have a long history with different kind of schools of thought. Initially, it was a moral failing back many, many years ago when people would go to the church, or there was a lot of judgment based on kind of moral standards. And then with the um, inception of AA and kind of more of a medical model of addiction, we started to kind of think of addiction as a disease, more of like a psychosocial illness. And now, even more currently, we're kind of shifting, not that we're abandoning the medical model, but we're also looking at other dimensions of social engagement, environmental, genetics, all the other different things that really do impact addiction, because it's typically not, I mean, it can be, but usually it's not a standalone issue. Usually there's co-occurring issues, usually there's mental health issues, and sometimes trauma is a component as well. So when treating addiction, we have to treat the addiction itself, usually in group therapy with something like DBT, learning DBT skills, cognitive behavioral therapies, and kind of the gold standard for that is that. But in addition, we want to kind of address any underlying mental health issues, which is best done with an individual provider, a therapist, or family dynamics. If there's a really chaotic home environment, we want to address family issues, social issues, as well as maybe medication management for if there's depression or bipolar co-occurring with the addiction. That absolutely has to be addressed, and it's not something that necessarily gets addressed just in like an AA program, any program, or peer support. So we really have to kind of rally all these different types of therapies, all these different types of support to give a person in recovery the best chance of sustaining a healthy recovery program. One of the most important key components to having a healthy recovery for any individual is going to be staying in touch with their emotions, to really addressing behavioral, mental health challenges that co-occur or underlie addiction issues. So, for example, if a person goes to AA and they maintain abstinence, say 6 months or a year, and they're starting to spend a lot of money on clothes every week, or perhaps they've engaged in gaming on their phones, or they've withdrawn socially and they just don't go out and play video games all the time. Their brain and body are really looking for that dopamine hit that they used to get from the old addiction, and it's kind of replacing that with another addiction. So when we just maintain abstinence and call that good enough for recovery, it's highly likely that something else is going to kind of creep in there to fill the void. So that void of what is driving us to seek the dopamine, what is driving us to comfort, what is the function of that addiction, usually ties into mental health. And that is really where addressing co-occurring issues is such an important thing. It's so important to find yourself an individual therapist, and to really kind of have a multifaceted approach to your overall mental health and physical health, so that you can sustain recovery and then not be bringing in all these other possibly maladaptive behaviors that turn into their own addictions.